Check this tooth out. This patient was referred to me for evaluation of tooth number 10. According to the patient, this root canal was done about 10 years ago in Vietnam. And then patient says, following the root canal, her dentist did an apical as well. And you can see the result of the apical. You can see that's looks like a retro fill. This looks like likely a fiber post, and you can see the large periapical lucency. A patient stated that she would get a swelling right above the tooth every now and then the swelling just comes and goes. So she finally went and saw her dentist, and her dentist referred her to us. So you can see, as I said, you can see the periapical lucency here, and number 9 and 10 are connected, as you can see here. The crowns are connected. So what do we do in a case like this? So I discussed, of course, all my findings with the patient, let the patient know that her tooth is abscessed, so she has an abscessed tooth, she has an infection, and went over options with her. And usually in these cases, I go over the option of redoing the root canal non-surgically. That's almost always recommended because we want to deal with the bacteria that are present throughout the entire length of the root canal system. We want to do that first, non-surgical retreatment first, and prepare the tooth for apical just in case if we need to do apical later, which means that if I non-surgically retreat this tooth, I will go through the fiber post. I use ultrasonics. I will remove this, whatever this is. I probably have to go through that as well with ultrasonics, and then do my instrumentation, shaping and irrigation, the 3-dimensionally activation, of course, 6% sodium hypochlorite, and then place an MTA plug, probably from the apex of the tooth to probably halfway. So if I ever need to do an apical in the future, apical is so much easier. I don't need to retro prep and retro fill. Okay, but usually the non-surgical works. So I told the patient we can either do that. I don't recommend going to apical straight away, or you can choose to have the tooth extracted and get a dental implant. But patient said that she wanted to try to see if tooth could be saved. So we scheduled her to come back so we can redo this root canal non-surgically and also get it ready for apical just in case if it needs it in the future.